Hi, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about a particular presentation for Lyme disease, which includes skin lesions. And the reason that I'm bringing this to your attention is that we just had a patient who has Babesia microtii, Babesia duncani, and Borrelia burgdorferi, and many mycotoxins, who had very strange, like bubbling lesions on his hands and on his legs, and we just couldn't figure out what it was, and so he went to a dermatologist and got the um, got the lesions biopsied, and guess what? They came back positive for an organism called MRSA, MRSA, and that stands for Methicillin-Resistant Staphylococcus aureus. Now, many species of Staphylococcus are naturally occurring on your skin. It's common, okay? That's the natural microbiome of your skin. There is, however, a genetically different organism that is a staphylococcus, and it is Staph aureus, but it's pathogenic, and it's bad, really bad. It will, I mean, you remember several years ago when there was MRSA outbreaks in hospitals, and people with really big, huge oozing lesions um, from MRSA. And MRSA is pretty difficult to treat. Sometimes you even need IV antibiotics. Sometimes you can use Bactrim, but sometimes you have to use stronger drugs. So stronger antibiotics. And a lot of times the lesions are like they ooze. They ooze, and uh, they're like kind of pustulars, but they can also be really deep. Deep into it's the epidermis, the dermis, and then epithelium, dermis. Why am I forgetting what the third layer is? I'm sorry, you guys, I can't remember. Anyways, you understand that there's layers of skin, and a lot of times MRSA lesions, they go way down into the deepest deepest layer of the tissues, and like almost to the bone, and that's why that infection is um, uh, difficult to treat. There's a number of things that um, can lend itself to developing MRSA, and that is being immunocompromised and being a diabetic. Intravenous drug users are at a much higher rate of developing MRSA. Regular contact with somebody who injects drugs. Um, Users of quinolone antibiotics, so things like Cipro and Levaquin, um, they can sort of make you more vulnerable to MRSA. Elderly people, school children that play in sports and share clothing, college students living in dormitories, um, veterinarians, livestock handlers, people who ingest pasteurized milk, people who are immunocompromised, which is what Lyme does, right? Lyme causes, your natural killer cells to plummet, and a lot of times also your T helper and your T suppressor cells to plummet. And then that sets the stage for the invasion of sort of more nasty pathogens like MRSA to take hold. So MRSA can be treated with antibiotics, but sometimes people need to be hospitalized. That's how serious of an infection. It's very serious, very serious. So the reason I'm telling you this is for the first time in 27 years of my practice. Actually, that's not true. I've had a couple of other people, but they got it when they were in the hospital. This patient was not in the hospital. I don't know how he got it, but they biopsied the lesions and they found it. So, he's on Bactrim now, and I expect that the lesions will heal, but I think it's going to take quite a bit of time. So I just wanted to share that little piece of Lyme trivia with you, and I hope you have a wonderful day. Take care.